Hi, we are Team 38. I'm Janani.
I'm Matthew.
I'm Krish.
I'm Alicia.
We'll be presenting to you the Incrementer, a simple solution for retinopathy of prematurity procedures. Firstly, what is retinopathy of prematurity? It is an eye disorder that primarily affects premature infants and is characterized by abnormal blood vessel growth in the retina. Most severe cases require treatment, and without it, this can cause severe visual impairment or permanent loss of sight. Our clients, the pediatric ophthalmology team at McMaster Children's Hospital, uses anti-VEGF as a treatment which is delivered in an injection to the eye. Our clients approached us with concerns about this procedure and asked us to form a solution that could make the process more stable. Specifically, physicians felt that for a procedure that required so much accuracy, the motion of pushing the plunger down caused unnecessary movement and increased the risk of error. Through multiple meetings with our clients, we were able to clearly understand the requirements for our design. We understood that due to the sensitive nature of the procedure, there were a few requirements that had to be met. Firstly, our design had to be sterile. The best way to achieve this would be through a design that could easily be made disposable. Another very important consideration is the size of the device, since a premature baby's eye is only about 17 millimeters in diameter. The last big consideration is that it had to be easy to use and similar to the current procedure, as retraining professionals could be a cause of error in and of itself and defeat the purpose of our device. Through understanding these various constraints and our objective, we were able to design the Incrementer, where you can use small increments for small patients.
Now I'm going to be running everyone through the assembly and functionality of our device. There are three main components in this assembly, the first one being your standard 1cc syringe commonly used in these procedures. This part of the device is known as the plunger cap. This part works similarly to traditional slide-on lids for containers. The top of the plunger, where surgeons push down for injection, slides into the slit of the plunger cap, where friction is used as a method to keep the cap secured. The last part is the plunger gripper that has two main components, a ring, which a surgeon can slide their thumb into, and a teeth-shaped pattern attached to it. The teeth-shaped component of the gripper slides into the square hole located on the plunger cap. Similar to a zip tie, the teeth slide one way and grip the plunger cap the other way to begin injection as seen here. To show the functionality of our device, I'm going to run everyone through three examples where different increments can be used to inject the medication. As a team, we understand the precision needed for a delicate procedure such as this one, and to increase precision, we included several teeth on the gripper. Surgeons will no longer need to displace their thumb a significant distance in order to inject the medication. Not only does our device decrease thumb displacement, but it also gives the surgeon the flexibility of injecting the medication in as many increments they find fit, all while controlling the specific amount of medication they injected. Although there are many pros in the functionality of our device, we must also take a step back to look at the cons in both the ideation and design stage of this project.
Looking at our drawbacks, let's first cover the ideation process challenges. There were several factors that we needed to consider. The first factor we needed to consider was addressing the needs of our client. They required a syringe that increases stability by reducing the range of motion of the thumb. Keeping that in mind, we developed a list of constraints and functions that we wanted to adhere to. Some of these constraints and functions include sterility, visual clarity, and how ergonomic the design is. Lastly, we had to develop tangible ideas, ensuring that our potential solution was neither too complex or too ambiguous. Some things we avoided were including gears or completely changing the manner in which the syringe would be used. Keeping these ideation process drawbacks in mind, we developed the Incrementer. The Incrementer is our final design that adheres to our criteria. However, it is not without its drawbacks. The Incrementer has three main flaws. First, it has a potential to slip while the syringe is being depressed. Second, the plunger gripper could potentially be caught on the syringe during usage. And third, the Incrementer could obstruct the view of the orthopedic surgeon in certain positions. One minor flaw that the Incrementer has is that the plunger can be bent if the syringe is depressed with a strong horizontal pull. Now, let's look at what we can do to develop an overall better device. Looking at the ideation and design challenges, we can develop key aspects that can help improve our overall process. Some of the things include building a low-fidelity model, seeking guidance and feedback, as well as researching more into existing/emerging products.
In order to ensure that our device will be suitable for clinical use, it's important that we continuously refine our design in response to imperfections that we observe, as well as in response to client feedback. In the future, we'll need to continue having idea generation sessions to come up with solutions to the current errors. For example, to correct the fact that the thumb ring may not be compatible with every physician, we may want to change the ring to a hook so that any thumb will be compatible. As for the teeth-shaped component getting caught on the barrel, we may want to implement an additional attachment that prevents this. Of course, these are all things that we would need to further discuss in ideation sessions. The process of designing, prototyping and presenting the device, receiving feedback, and implementing changes is a process that will likely occur many times before reaching a final product, but this will ensure that we're developing the best solution for the needs of our client. And once a finalized design has satisfied the client, the device should be registered for approval as a Class 2 medical device with Health Canada. The steps in this review process include submitting a medical device license application, waiting for the Medical Devices Bureau of the Therapeutic Products Directorate to review the application, and if the information provided meets the requirements of the medical devices regulations, the license will be issued. The device should then be ready to use in clinical settings. Thank you, and let's help save the vision of tomorrow.